chart preppers and coders. These are the behind-the-scenes heroes you don't always hear about, but they're essential to making healthcare work. Because, let's be honest, medical documentation isn't exactly thrilling, but it's crucial. Without accurate records, patient care suffers, clinics lose revenue, and compliance becomes a nightmare. And here's the kicker. It's not just the clinicians making this happen. There's a whole team working behind the scenes. Nurses, medical assistants, scribes, and coders who keep the system running like a well-oiled machine. Today, we're shining a light on how their roles impact the entire healthcare system. But first, why do we use chart preppers and coders rather than nurses, medical assistants, scribes, and coders? In a Medicare Advantage clinic, the involvement of non-clinician roles is often not standardized between different organizations. For example, an organization may have medical assistants reviewing records to prepare for visits, while another may assign this responsibility to their scribes. Because of these variations, rather than dividing our material based on job titles like medical assistant or scribe, we categorize them based on their actual responsibilities. The key division we use is based on whether or not the user needs to know ICD-10 coding. So, how do we divide them up? We use two categories: chart preppers and coders. Chart preppers do not require knowledge of ICD-10 codes, and their primary responsibility is reviewing information before a patient's visit. They can identify diagnoses or relevant medical information without directly using ICD-10 codes. For example, they can review an echocardiogram and determine that a patient likely has heart failure, then relay that information to the clinician. On the other hand, coders include both credentialed coders and anyone responsible for coding-related tasks. They need to understand ICD-10 coding rules and assist clinicians with documentation. These are the key differences in responsibilities. Chart preppers work primarily before the patient visit, gathering relevant medical information without needing ICD-10 knowledge. Coders focus on ensuring correct documentation of diagnoses and procedures, usually during or after the visit. So, how do we divide them up? We use two categories: chart preppers and coders. Now let's break it down. These roles work in two different groups behind the scenes to ensure every diagnosis is accurate and accounted for. The first group works before the visit, and the second group after the visit. Before the patient is seen, we have medical assistants, registered nurses, and scribes. They gather patient histories, check specialist notes, and prep charts to flag potential diagnoses. After the visit, coders and clinical documentation CD specialists step in. They review the visit notes, match conditions to the correct ICD-10 codes, and ensure that each diagnosis is accurately documented. And here's the big takeaway. Both groups are constantly finding new diagnoses that impact patient care and reimbursement. The better they do their job, the more accurate and complete the patient's record will be. So, let's dive deeper into what happens before a patient even steps into the doctor's office. Chart preppers do a deep dive into patient records, searching for potential diagnoses hidden in lab reports, medication lists, and specialist notes. Think of them like detectives, scanning for clues to ensure nothing gets missed. For example, let's focus on just one area: documented diagnoses. A patient's chart might initially list diabetes without complications and a pacemaker, resulting in a RAF score of just 0.192. However, during chart preparation, a trained professional may notice that the patient's lab results or prior diagnoses suggest chronic kidney disease, CKD, which is not yet documented. At this point, the chart prepper can make key adjustments. Link diabetes with chronic kidney disease, CKD. This simple connection can change the hierarchical condition category, HCC, and potentially increase the RAF score. The patient has a pacemaker but isn't coded for active sick sinus syndrome. Correcting this documentation adds another HCC. Additional missing diagnoses might be present elsewhere in the chart. If identified and properly coded, the RAF score could increase even further. By making just these known changes, the RAF score jumps from 0.192 to 0.502, a 2.6x increase. And if additional relevant diagnoses are confirmed, the score could reach between 0.65 and 1.35, translating to tens of thousands of dollars more for the patient's care. This is why chart preppers play a critical role. Their attention to detail directly impacts patient outcomes and clinic reimbursements, all before the doctor even walks into the room. Now, let's talk more about the patient visit itself. Medical assistants and nurses aren't just checking vitals, they're gathering critical data. A slightly abnormal oxygen level? That might be an early sign of respiratory failure. An unusual heart rate? Could be an undiagnosed arrhythmia. But here's the problem. Not all medical assistants know which signs should be flagged. A little extra training can provide an opportunity to flag potential abnormalities for the clinician to review, helping them catch a serious condition early before they are missed altogether. After the patient leaves, the work still isn't over. This is where coders step in. They make sure every condition is properly documented using ICD-10 codes. These codes aren't just medical jargon. They directly influence if insurance will approve of treatments, tests, and reimbursement. If a diagnosis is missing or coded incorrectly, the clinic loses money, and the patient may not get the proper care. At the end of the day, healthcare is a team sport. While doctors get most of the spotlight, it's the behind-the-scenes heroes, the chart preppers, medical assistants, scribes, and coders, who keep everything running smoothly. If you found this video helpful, don't forget to like and subscribe to DoctusTech on YouTube for more insights into the world of value-based care.